Hello, 𝗵𝘃𝗀𝗶 Palsy here. Hope your Monday is to a good start. Today, real quick, something to remember is that 𝗵𝘃𝗀𝗃 palsy is, for the most part, and for most people, is only going to happen once. It is quite rare to have recurrences of facial paralysis like this, idiopathic facial paralysis. And for anyone that is going through their second or third or hopefully no more than that round of facial paralysis and 𝗵𝘃𝗀𝗃 palsy, I would highly suggest that you get checked by an ENT or a neurologist, because according to the research, people that have a recurrence of 𝗵𝘃𝗀𝗃 palsy on the same side, if it's on the same side, turn out that actually 30% of these patients tend to have a parotid gland tumor or a tumor growing around the facial nerve. Sometimes when the tumor grow, you can have some symptoms for a while, and then it kind of stop, and then kind of go back and forth at various level of severity. And I would highly encourage you to have that checked closely if you do have recurrences of 𝗵𝘃𝗀𝗃 palsy to the same side of your face. And of course, on the other hand, if you have lots of weird symptoms with your facial paralysis, that is something to really look into with a physician and have several tests done. The main one that comes to mind is, of course, being tested for Lyme disease, especially if you live in an area that is pretty prominent with that. And I'm thinking the Midwest and the Northeast of the U.S., where tick bites will actually can result in Lyme disease. And this is actually pretty serious stuff. Lyme disease has so many complications, and it's a severe neurological complication, and it's not something to play lightly with. So if you're, especially being in the summer now, being out and about and hiking and all this stuff, it's quite easy to encounter a tick and get bitten. So if you have anything that is just kind of a little bit more suspicious than just a typical 𝗵𝘃𝗀𝗃 palsy, with some weird symptoms, anything that is just, at first, 𝗵𝘃𝗀𝗃 palsy is mostly for those 3 days, for the first few days where you're really, for most people anyway, where you're gonna have a lot of tearing and really no movement at all, and headaches and earaches and all this. But that, especially as you get on the steroids and the antiviral, that should kind of go away fairly quickly. And if it's not, then just go back to your doctor, or go to a doctor you haven't seen. Just shop around as needed, but that needs to be addressed. So once again, recurrence of 𝗵𝘃𝗀𝗃 palsy is not. It's rare, and there could be something underlying. So please talk to your physician about that. All right, have a good rest of the day. Take care. Bye-bye.